Hello everyone, Dr. Frank DiLollo, DiLollo Chiropractic Center. Today we're going to show you how we take care of pregnant mommies. We have our patient Vicky here today. Vicky's been under care since you are how long?
16 weeks.
16 weeks. You're currently?
24.
24 weeks. And we were talking, and we know that you're getting adjusted during this pregnancy. You have another child, a 2-year-old.
Yes.
And you didn't get adjusted during that pregnancy.
No.
So just share with me in your own words what the difference was in, so thus far in getting care the second time and not the first.
When I was pregnant with my son, about a little before halfway through my pregnancy, I was experiencing really, really bad nerve pain. I think it was just where he was sitting around my hips, and no matter what I did, I tried all those different bands that lift your stomach and everything, and none of that worked. So I pretty much had to tough it out for the duration of my pregnancy. This time around, I haven't had any of that, so hopefully it continues.
So we're good. Again, 24 weeks you said?
Yes.
And so what brings you in today?
Just normal aches and pains, really. I had some pain in my neck the other day. I get a little tight in my lower back, sometimes depending on how much I'm moving around, but
okay. So some neck pain, some lower back pain. She's 24 weeks. It's going to happen. The weight is shifting and changing position. So let's give her an adjustment. Let's show you. Go ahead and go face down. Notice that we have pregnancy pillows, right? So Vicky is face down. We have special pillows for her to do that so her tummy feels good. In fact, a lot of the pregnant patients share with me they wish they had a table like this so they can lay on their stomach, because they don't lie on their stomachs during pregnancy, obviously. It's kind of comfortable for them. So what we're establishing with Vicky right now is we're finding out whether her knees and or her ankles are out of alignment, and we're going to adjust them accordingly. So her left knee is a little bit involved, a little bit of a misalignment there. How does that get misaligned? It gets misaligned due to stresses of life. Vicky's not stressed out because she's pregnant, but her body's a little bit under stress for sure, because it's changing. So now we're going to do an adjustment into the pelvic area and balance that out for her as well. Again, very light, very gentle, but very effective. Good. Okay, now let's figure out what system in her body is actually out of balance today. So we're going to do that by palpating, feeling 6 points on the back of her head. Vicky, you're going to give me some feedback here. I'm going to go to number 1. I'm going to count them all for you, as you know, and you're going to tell me which one feels the most tender. I want to make sure we get in the right. There it is. Okay. So there's 1, there's 2, there's 3, there's 4, there's 5, and there's 6. 6 is the most tender.
Yeah.
Okay, so we're going to help her neck pain that she's having. We're going to help her lower back stiffness or tightness that she's having as well with this adjustment. But what I'd like to bring out to your attention is the number 6 system in the body happens to be the circulatory system. So this adjustment is going to actually help and improve all the circulation in her body. Heart, blood vessels, arteries, veins, lymph as well. We're going into the areas of her spine that are going to stimulate the part of her brain that govern the entire circulatory system. Vicky, how you doing?
Yeah.
Good. And we're going to do another adjustment in her upper back right here. And then we're going to finish up in her neck area, in the lower portion of her neck. A lot of people are apprehensive about getting their neck adjustment. When we perform it with this adjustment, with this instrument rather, it's pretty digestible, would you say, Vic?
Oh, yeah.
Yeah. Beautiful. Now, we're going to recheck that spot. We're going to go to the number 6 spot, because that was the system that was out of bounds that Vicky shared with us. 1, 2, 3, 4, 5, and then 6 should be right there. How does that feel?
Big difference.
Big difference. Feels better. That means we absolutely balanced out that system for her today. So we did an adjustment, opened up all the nerve energy into her neck, into her lower back. Baby's getting fed properly. She's getting fed properly. Things are working better. And that's how simple an adjustment can be for someone who's pregnant. Until next time, I'm Dr. Frank DiLollo.